So first, I'm going to begin by stating the proper injection sites for a subcutaneous injection. So first, you have the outer posterior aspect of the upper arm. Then you have the abdomen from below the costal margins to the iliac crest, and then the anterior aspect of the thighs. So first, I'm going to begin by washing my hands with some hand sanitizer. Then I'm going to locate the MAR, patient, date of birth, allergy. So I see I have Anna Pawlowski, born May 5th, 1957, allergic to penicillin. Her reaction is hives. Then I'm going to check the MAR for any medications. So I see she has a B12 subcutaneous injection on her MAR. Then I'm going to compare the MAR to make sure it matches the orders. And I see that the orders also has a B12 subcutaneous injection for Anna Pawlowski. And then I'm going to go to the med room, retrieve my meds, and this is where I'll perform my first check. So I have the right patient, Anna Pawlowski, right drug, B12, amount, 500 micrograms, route, subcutaneous, and time, 1500. And then I will be having to do a calculation. And I'm going to check the vial for the expiration date, so May 2029, so it's still good. Then I'm going to assess my drug resource to make sure any information you need to know about the drug itself. So B12, I would assess the patient for any B12 deficiency prior. So that could look like pallor, neuropathy, psychosis, a red inflamed tongue, and possible adverse reactions include hypertension, erythema, rash, and red urine. Okay, and then my calculation, so ordered is 500 micrograms. On hand, we have 1 milligram per ml. So 500 micrograms over 1,000 micrograms times the 1 ml means I'll be administering 0.5 mLs. And then so the proper needles for a subcutaneous injection. So it can be anywhere from a 1/2 inch to 5/8 inch needle, 25 gauge. I'll be using a 5/8 inch needle, 25 gauge, and a 1 ml syringe. And then this is where I'm going to be performing my second check. So again, locating the MAR, comparing to the drug. So we have Anna Pawlowski, right patient, right drug, B12, amount, 500 micrograms, 0.5 mLs, subcutaneously at 1500. Okay, and then I will get my vial. It's a multi-use vial. If it was brand new and I was opening it for the first time, I would time, date, and initial it. It's already been open, so I'm just going to be cleaning the rubber stopper with a alcohol pad for 30 seconds. Okay, discard that. Okay, 30 seconds. All right, 30 seconds, kind of let that air dry. I'm not gonna fan it with my hands or anything. Then I'm going to safely uncap my needle using the rainbow method. Okay, I'm going to draw back the 0.5 mLs of air. Okay, then holding it like a dart, I'm going to insert my needle into the rubber stopper in the vial, inject my 0.5 mLs of air. Okay, and then I'm going to invert my vial and I'm going to draw back my 0.5 mLs. Okay, and then I would tap it. Any air bubbles or anything to go to the top. Okay, make sure I actually have the right amount, 0.5 mLs. Okay, then I'm going to safely cap my needle using the one hand scoop. Okay, and then I would label my syringe with the barcode. Okay, I can get rid of this. So then before I go in, I'm going to assemble my necessary equipment. So I've got my medication, I've got my gloves, alcohol pad, I've got gauze. Then I'm going to knock, 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 wash my hands, identify myself. I'm Sarah Nelson, I'm your student nurse. Can you tell me your name and date of birth? Then I would compare the wristband to the MAR. Do you have any allergies? And then ask about the reactions, and again, compare the wristband to the MAR. And just explain why I'm here. I'm here to give you your B12 injection. Then I'm going to make sure I have a safe environment, so the bed's at a good height, there's no clutter, remove any equipment in the way. Then I'm going to close the privacy curtain. So then I'm going to do any necessary assessments beforehand, such as checking for a B12 deficiency. Then I'm going to teach the patient about the medication. So I'm going to tell her that the injection is to help improve her B12 levels, or maybe if someone has anemia. And then I'm going to do my third check. So again, I'm going to check the medication against the MAR. So I have Anna Pawlowski, right patient, right drug, B12, amount 500 micrograms, 0.5 mLs, route sub-Q, and then time 1500. So I'm going to scan Anna Pawlowski's wristband, scan the syringe, and then I'm going to position the patient properly, make sure I can access the site. I'm going to be doing the outer posterior aspect of the upper arm. Put on some hand sanitizer, don my gloves, and these gloves are a little small, so bear with me. So it might take me a second to put them on. Just making it work with what I have. Oops. Okay. I would definitely need to size up in the real setting. Okay. All right, there we go. Gloves on. And then I'm going to be cleansing my injection site with the alcohol pad. All right. Open this up. And again, I want to cleanse the site for 30 seconds. Can't quite pinch it. There we go. Okay, so I'm going to be opening up my alcohol pad. Cleanse the site. So I'm going to move it in circular, small circular motions, starting at the center, and then slowly working my way out, making bigger circles. Okay, 30 seconds. I'm gonna let that air dry. I'm not gonna fan it with my hands or anything. And then at this time, I would safely uncap my needle and I will hold it like a dart. I'm going to pinch the skin, and since I'm able to pinch a solid 1 to 2 inches of skin, I'm going to inject it at a 90-degree angle. So insert my needle, push the med slowly. Okay, remove my needle. And then I would apply some light pressure with the gauze. I'm not going to massage it or anything like that. And for the sake of the video, since I will be reusing this needle, I'm not going to engage the safety on the needle. I'm just going to do the one-hand scoop method to safely recap it. And again, if I had engaged the safety and everything, I would discard this needle in the sharps container. Then, okay, like I said, the light pressure. Then I'm going to discard any supplies, clean up my environment, remove my gloves, wash my hands. Then I'm going to do any necessary documentation. So I'm going to document that the medication was given, document any assessments I did, and then I'm going to assure a safe environment. So I'm going to make sure the bed's in the lowest position, no clutter, call lights in reach, and then I'm going to make sure the patient's comfortable. I'm going to ask if there's anything I can do before I leave. I'm going to open up the privacy curtain and then wash my hands and foam out. Thank you.